Welcome to Healthline. I am Gregory Zeri, and it's the end of August. Summer vacation is coming to an end. School is back up. You know, when summer's here, we always go a little bit slower, get a little more relaxed, and we're getting ready for the fall, for the holidays, diving into the new year. Before you know it, it's 2016. I know I'm going fast, but here's what happens, though. We are so relaxed, we then start going so fast. We're at the computers, we're at our desks, we're doing our things, we're on our iPads, our phones, and we think about our bodies, we think about, you know, whether or not we work out, whether or not we sleep, we eat, we think about everything, but there's 10 things we really don't think about, 2 things with 10 attachments that we don't really think about all the time. Our hands. We use these all the time, and we don't give them a lot of praise. We get angry when they don't work. Sometimes we go like this and we think, oh, I'm giving myself arthritis. There's just so much wear and tear we put on these. So I decided to bring you a hand specialist, Dr. Rizvi from Glendale Adventist Medical Center, and he's going to share with us everything we need to know about hands. He's going to tell us what it means if there's tingling, if there's pain, if there's burning, what's going on, what's not going on, and how to take better care of these, our phalanges, right?
Yes.
Welcome, Doc. How are you?
Nice to be here. Thank you.
It was good on the intro because we really do not pay a lot of attention to our hands.
You hit the nail on the head right there. Our hands are probably one of the most complex organs we have, and
we don't think about our hands.
We don't.
I mean, we kind of throw our hands away.
We do until it becomes a problem, right?
I know, right?
Yeah.
Why do you think that is?
Well, because it's second nature to us.
Okay.
We use our hands literally for everything, and we expect it to be there. And then when something goes wrong, we notice that our life suffers. Whether it's work, whether it's sleep, whether it's your sports activities, your weightlifting, your yoga, whether it's being on the internet and playing a video game. So all these areas of our lives are affected by our hands.
And we abuse these all the time.
Well, the world has changed with social media, with the internet, with computers. We're always using our hands, and we're not giving them the rest that we used to back in the day when computers and technology didn't exist.
Thank you, Doctor. Okay, so when we come back, I'm going to share with you how to give these puppies the respect they deserve, and also signs and symptoms: pain, tingling, burning, itching, what all that means, and what you need to do, and also how to take great care of these paws. More on your hands when we come back. Don't go away. Welcome back to Healthline. The entire conversation is all about your hands. Okay, do me a favor, count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 fingers. We work these hands, these fingers, we work them out so much, and what we don't do is we don't take care of them. Joining us is Dr. Rizvi from Glendale Adventist Medical Center. He is a hand doctor, and he's going to share with us all we need to know. You know I can count.
You count really well.
Thank you,
and you're using your fingers.
I am using my fingers. Doc, we put so much wear and tear on our hands.
All the time.
And we were touching on it just a little bit. Why do you think we take them for granted?
Well, because as I mentioned before, I think the biggest thing about hands is they're so vital to our lives.
True.
And when we don't think about something and we think it's going to be there and it's not, that's when it affects us the most. And so I think we don't realize that we're always using them, and then when suddenly something happens, like you get your finger jammed in a door, or you notice a growth on your finger, or something starts hurting, then activities get diminished, and you start having pain, and you notice you're not doing something like you did usually. And they're important things in your lives, and that's when we really notice, oh my God, something's wrong with my hand. I need to get this fixed because I can't take care of my child, or I can't cook dinner.
Do what I got to do.
Exactly.
You know, we were talking during the break about people really not taking care of their hands.
Sure.
And when I first opened, we talked about people going back to work, and we're going into the fall. You threw out a great solution, and I just want to start the episode with that, is give our hands a break.
Absolutely. So in the information age, it tends to be that more and more people are working with computers or gadgets. We're on our iPhones, we're on our iPads.
And kids are on the games they're on.
Exactly, video games. What we have to realize is we weren't built to be using our fingers 24 hours a day or constant motion. And that takes a wear on our ligaments, our tendons, our nerves, our muscles, and our bones. So resting our fingers just 5 minutes on the hour can make a big difference.
So when you say rest, is it kind of like giving your hand a nap?
Exactly.
And it's seriously just having your hand do nothing?
Exactly.
When we started, I pulled my fingers, and there's a huge urban legend, myth, that this attributes to arthritis.
Sure. So
Yay or nay?
Partially.
Oh, it can?
It can, yes.
Okay, because I thought it was just releasing some air in the knuckles.
Well, it depends. If the cartilage on the bones are rubbing against each other abnormally, then yes, that's causing arthritis. And if you feel pain when you're doing that, then specifically you should stop and not do that.
Well, as per with anything else. So if you go like this and you want to vomit from the pain, that means stop and then go see your doctor.
Correct. Correct, absolutely.
So what is a great hand resting solution? Is it
I don't think there's
massage
one.
your hands or just
There's not
stop?
one certain posture or one movement. It's just about giving yourself a break and doing something else, like reading the monitor screen or just drinking a cup of coffee, which involves using your hands, but it isn't the repetitive type of motion that you're doing on a daily basis with, say, a computer or say on a computer screen or keyboard or something like that.
And we get in trouble from doing the repetitive.
Correct.
Since I'm doing this now, doctor, and I know the word ergonomics is where you sit properly and stuff.
Sure.
Is there a right or wrong way for somebody that's at a desk with their hands?
There's better positions, certainly.
What is considered a great position for someone?
Well, you have to look at the whole body, and I think keeping your back straight, keeping the keyboard at a certain level that isn't too low or too high, not injuring your neck, because the nerves go down through your arms into your hands, and so when your neck is flexed or extended, that can cause undue pressure on your spinal cord and the bones, and that can affect your upper extremities. So neutral positions are best, where you're comfortable and you don't have to do a lot of motion other than what you need to do to get your work done.
Got it. Okay, so I hope you're paying attention to that. And if you don't know, if you are sitting ergonomically proper, Google it. Go, how do I sit at my desk properly, and find out the proper height and weight and exactly the type of chair too that you need. Because all of it contributes to itself. And also what we've talked about on Healthline too is every hour you're at your desk, take 5 to 10 minutes.
Correct.
Stand up, stretch, walk around the floor where you're at, take a few deep breaths, get some
it helps tremendously.
And water, drink tons of water. Because a lot of people think that their headache is coming from, or their pain is coming from, it could also be that they're dehydrated.
Correct.
Doctor, when we started, we talked, I brought up some symptoms.
Okay.
Just say somebody has tons of pain in their fingers. What could that possibly be?
Well, it depends on, it could be something related to the nerves, it could be related to the joints, it could be related to the bones, the ligaments, the tendons, or the muscles. And so there's different types of pains, and that's why it's really important when you're experiencing hand pain to see a doctor and see a hand specialist if you can, ideally, to really evaluate where that pain is coming from.
Before we go to our next break, do you find that a lot of people will not see a hand specialist, but they'll see a different type of doctor?
Typically, most patients will go to their primary care doctor or their primary care provider first, and they can get a basic workup done, for example, like an x-ray, just to see what's going on. But really, it benefits them to go to a hand specialist if there's something really complex going on.
I love that. We're going to find out more about the pain, and when we come back, we're going to spend more time with Dr. Rizvi finding out exactly what it possibly could be with the pain. And again, tingling. I get a pain right through here on my thumb, so I'm going to ask Doctor what that is. Do something fun with your hands. And when we come back, more on the hands. Don't go away. Welcome back to Healthline. It's all about the hands. When I said at break, do something fun with your hands, what did you do? I was making hand puppets. We take these for granted. We beat them up all the time, and we don't give them the rest. We just talked about giving your hands a little bit of a break every couple hours. Joining us is Dr. Rizvi from Glendale Adventist Medical Center, a hand specialist. And right before the break, I asked about if there's pain in your hands. Doctor, what is pain in, I mean, I know you said it could be joint, it could be other things. What is the most common reason for pain in the hands?
Right now, it depends on age specific. For our younger...
So talk to us first about age. Let's go younger.
Okay, so the younger patients are coming in more and more now, so with carpal tunnel syndrome.
Okay, what is that?
It's a compression of the median nerve in your wrist. And
okay, so if we break it down, the median nerve is right here?
Right centrally located on the palm surface of your wrist.
Okay. And what is this from?
It's really from repetitive motion and the ligament on the wrist getting thick and pushing on the nerve, which causes numbness and tingling in your hands and wrist pain.
Is any of this, is that hereditary?
There can be hereditary components to it, but it's typically something usually related to repetitive motion.
Such as
computers, typing, you know, dentists will have it. Industrial workers will have it, cleaners, you know, all types of people.
So is there, what is the solution for carpal tunnel? What would you do?
So there's conservative and more aggressive approaches. The more aggressive is surgery, which is a carpal tunnel release. Conservative starts with just resting your hand, getting anti-inflammatory medications, using splints.
You see people in the hand splints?
We do, yes, carpal tunnel splints. And so a lot of them will get better with that, a proportion won't, and then they'll need more aggressive measures such as steroidal injections and or surgery.
So if you have carpal tunnel, there is a solution and a remedy.
Correct.
Trigger finger. What is trigger finger?
Another repetitive motion injury that we're seeing more so in our younger groups as well as in older patients. For example, people who are very athletic, who are weightlifters, they'll find out that their fingers are locking, and that's because their tendons have been moving so much that it's causing friction on the covering on the tendon, and it's trapping the tendon and thus causing the finger to lock.
Okay. How do you entrap a tendon?
So because of inflammation, the covering on the tendon reacts and gets thicker. As that covering gets thicker, it pushes on the tendon and it causes the motion to stop, so that the tendon almost gets trapped in one location.
So it's kind of like a break lock.
Correct.
Is there something you can do though? I mean, can you give yourself a hand massage? Is there something you can do to be preventative?
So preventative measures again involve rest, anti-inflammatories. There's physical therapy.
Anti-inflammatories,
such as Tylenol, Motrin.
Motrin.
Yes.
Do you believe in holistic care?
I think there's a component of holistic care for everything. Traditional medicine hasn't studied it as much, but I always tell my patients, listen, do what works for you, and if something is working for you and you feel like it's making you better, that's great, and I'm on board with that.
So knock yourself out with stuff. I've heard turmeric is great for inflammation. Collagen is great for joints.
Correct.
And also the big conversation for years is omega-3.
Correct. So you know, literature is a little bit far behind. When there's certain things we know really help, but there's certain things we're still studying as Western doctors, and we know there's a component of it. We just can't pinpoint all the things to do, or all the medicines, or all the mommy therapies for getting a hand better. But we know that there's a component that definitely helps with that.
And it contributes with it.
Sure.
And then also, I'm a huge proponent of physical therapy.
Correct.
Tendinitis, doctor. Tell us what that is.
Another repetitive motion injury, or it can occur due to trauma, or it can occur due to something pushing on our tendon, like a tumor. So these are symptoms that you shouldn't take lightly. Most tendinitis occurs because of an injury or because we're using our hands too much. For example, let's say we decide to fix our whole lawn in one day, and we are out there for 10, 12 hours, which is not normal, but people...
Or just hire someone to help you.
Sometimes we don't do that. We decide to clean the attic
become Superman
in one day, and we'll come in the next day and we'll be really sore and stiff, and it's mostly because you just were working repetitively for so long.
You overexerted.
You overexerted, yes.
So then how do you then... Is it all about just rest then?
Pretty much. It's pretty much about resting your hands and and really calculating what you have to do in your life and realizing that you shouldn't do it too much.
Okay.
You should do it in blocks. Instead of trying to, for example, paint an entire room in a day, paint a wall in an hour and come back the next day. Instead of trying to do a huge task in one day or in a repetitive type of manner, take breaks and rest your hands. And these are the biggest things you can do to prevent injury and to prevent pain and to prevent all the sequela of tendinitis.
And you also keep your momentum if you do a little bit at a time.
Correct.
We talk a lot about weight loss and getting your health on. I always say get your health on. And if somebody wants to start running again and they've put on 50 pounds, they will run 10 miles in one setting and they'll be in pain, they'll hurt, they'll be suffering, and be like, this is why I quit last time, and not do it.
Correct.
Instead of just maybe walking around the block a little bit, and then the block turns into 2 blocks and 3 blocks. And
absolutely.
Instead of cutting the 10 Diet Cokes out, cut down, go one at a time.
Correct.
Stuff like that. So do it gradual, so it then becomes a habit.
Correct.
And then you want to do more of it. And in regards to what you were talking about, bottom line is just resting.
It's just planning and resting.
I love that.
So we plan almost everything in our lives, and we just take our hands for granted, as you said. And so when you're doing any sort of task, just plan out that task and realize that if you try to bite off too much, you're probably going to take a hit in your hands and you're going to be hurting the next day. And so it's just that.
And you also won't want to paint that other wall if you're hurting.
You won't. And so it's thoughtfulness. That's it.
And being I love that, being very mindful. More about the hands when we come back. And once again, do something fun with your hands. Don't go away. Welcome back to Healthline. It's all about the hands. What did you do during the break? Joining us is hand specialist Dr. Rizvi from Glendale Adventist Medical Center. Doctor, we were talking quite a bit about tendinitis and other maladies. Signs and symptoms. So there's pain. What about when there's a tingling?
So that may be a nerve problem,
such
as carpal tunnel syndrome. Okay. And so if you're noticing tingling, definitely come in, see your doctor. You may need a nerve study to assess if you have a compression going on, causing like a carpal tunnel or another nerve entrapment.
Same thing with the burning and a tingling and an itching and all of that.
So burning and itching can be trauma related. Okay. It could be that you bruised yourself and you may have a little bit of blood under your skin, and that can cause itchiness. Burning tends to be a problem with nerves as well. Okay. More chronic injuries. So
I work out a lot, and I'm chronically getting a little bit of pain through this thumb. What could that be? That
could be your ligament becoming lax and the bones rubbing against each other at what's called your metacarpal joint of your thumb, and causing pain and laxity right there and instability when you're doing something heavy or when you're pinching something with your index finger and your thumb.
Okay, I'm such a bore. How do I fix it?
Well, the biggest thing is you have to get it assessed. And there's degrees of severity. For really minor things, we do splints and we do physical therapy to strengthen up the hand. For more aggressive laxity or arthritis, we reconstruct the area.
Oh, then I guess I'm going to be making an appointment with you. Doctor, talk to us about orthopedic hand surgery and what's the difference between orthopedic surgery and orthopedic hand surgery.
So orthopedic surgery generally deals with all the bones of the body, the muscles, the tendons, and hand surgery is amalgamation of orthopedic surgery and plastic surgery. We deal with all the things that orthopedic surgeons deal with as well, but we also handle skin problems such as skin cancers of the hand, tumors, and we're not just dealing with just the underlying surfaces, but also all the way up to the superficial skin.
So, on top.
Yeah.
In regards to skin cancer on the hands, what does somebody look for?
So pigmentary changes, something new popping up and growing, bleeding, ulcerating.
Right.
Correct. And those are things that are concerning, and you should see your doctor right away.
And a lot of stuff could just be sun damage or age spots.
Correct. So putting sunscreen on your hands is a great thing.
Doctor, people will come into you then and they will have to lose a digit, a finger.
Sure.
What does that entail?
So amputations happen, and it's a devastating injury which can occur in all range ages, from very young kids who cut off their fingers in a doorway from a construction worker. Depending on how mutilating the injury is, we sometimes can save the finger and reattach it and do what's called microsurgery, which is reattaching the nerves and arteries with a microscope.
So everything would come back as normal, or would there
there would be scar tissue in the area, and we'd have to work with physical therapy, and sometimes the results are poor, but sometimes the results are excellent. It tends to be how young the patient is and where the amputation is occurring that will determine how good the rehabilitation is. And obviously the mechanism. So something that's a devastating crush injury doesn't do as well as a fine knife injury, for example, because less tissue trauma.
Before we wrap out, doctor, talk to us about arthritis.
Sure. Arthritis is something that we all face.
Okay.
And it's a problem that 100% of humanity will face at some point or another. And it occurs in the hands a lot as we age. We will start experiencing visual changes in our hands and our joints. Our motion will diminish, and at times when we're doing certain activities of daily living, we'll start getting pain.
Okay.
And there's tons of modalities of treatment, and we've all read about them, from drinking some elixir to rubbing cream on your hands to going in and having surgery. We're here as hand surgeons to help with that and determine what treatment is best based on the severity of the anatomy that's going on. But there's many things you can do, and those options can be discussed individually as you come in based on your x-rays and your findings.
Is arthritis similar to rheumatism?
Rheumatoid arthritis is a type of arthritis that has a genetic component that can cause arthritis throughout many joints in our body, and it can specifically cause devastating joint problems in the hand as well.
Is there any way to prevent any?
So rheumatoid arthritis, we do not have a cure for at this point, but we're doing research on it, and we're trying to develop new medicines, and that's the growing thing about arthritis, is trying to give patients non-surgical options so that the arthritis never happens. And that's talking about regenerative medicine with things like platelet-rich plasma and things that are on the way that we're still researching.
Because that's up and coming, isn't it?
It is.
It's basically taking your own blood and
injecting it in a joint and seeing if that can recreate a nicer environment, a less inflammatory environment. And we're also trying to use hyaluronic acid and other types of modalities that are less invasive to get people healed and get them less pain and more motion.
And to get someone less, when you have a procedure or you're knocked down, you don't want to get back up so quickly because of the pain. So is a lot of the research that you're finding to make it a lot more simple and less time effective? So
even with fracture surgery now, for example, the wrist gets fractured is one of the most common fractures in the upper extremity. We've learned that getting people motion and physical therapy faster gets them recovered faster, gets their range of motion better, and so gets them going along in their life quicker. And so we've developed newer implants, newer techniques, better technology to get people fixed and get along and healed faster and moving to recovery faster. And we do it a lot with our athletes or with professional sports players.
I love that. So it's to get someone not knocked down, but to get them back up and live their life more. Doctor, your last thought about the hands?
Well, I would have to say it's one of the most important things we have. And if you have a problem, come in and see us. We're happy to see all problems. Doesn't matter what it is, from something which you think is a nagging injury to something that could be a devastating trauma. We deal with the full gamut, and we're happy to see anyone at any time. But just don't ignore it, because if you ignore it, it's only going to get worse.
And I'm coming to see you because I want to know what this is. Remember, the most important conversation you're going to have is about you and your health. So if your hands are feeling weird, or there's a pain or a burning or anything, or there's something going on here, call your hand doctor. And remember, give these a rest. For more information on this or anything else, visit us on the web at glendaladventist.com. Gregory Zarian, we'll see you next time.